to NTF, everyone. My name is Judy Dukeshire, and I'm the Director of Nursing the Future. I'm pretty excited to welcome Rebecca Markle and Laura Vogelsang. These young entrepreneurs have initiated a support network through a business of theirs for students and newly graduated nurses moving. I'm sure it's for more than just students and newly graduated nurses, you guys, but for the purposes of our meeting, they're going to talk to you about med-surg nursing, preparing you to enter that or continue to practice in that particular area. And I'm going to hand it over now to Rebecca and Laura. Welcome.
Thank you.
Thanks, guys. We're so happy that you're here. As you mentioned, we are two nurse entrepreneurs. We grew up together, so we collaborated right before COVID hit, and we took our expertise online through Instagram, and we developed and created Nurse It Like You Mean It. That mantra is really for you to nurse like you mean it. There's not many extra filler words associated with that, but that mantra is so you can carry on nursing to the best of your abilities. And those of you moving into med-surg today, that's what we're going to talk about, especially as a new graduate, but also maybe currently in med-surg and just wanting to enhance your knowledge skills. And of course, to those instructors who maybe want to enhance your students' abilities working in med-surg and then potentially moving into that environment post-graduation.
I'll just preface telling everyone I'm getting a little bit over a cold. So normally I would never chew gum at a public presentation, but if you see me, that's why. I just don't want to start coughing on you. So I'm sorry for that. And if you can't hear me or I sound a bit groggy, just let me know. So we do just want to learn a little bit about what brought you here today. So you can see the poll up on the screen there. Just curious what best describes the reason that you came into the event today. So maybe you're a student wanting to work or already working in med-surg. I know there's lots of opportunities even before you graduate. Maybe you're a new graduate. Perhaps you're a nurse that works on the floor and you really want to foster and create that welcoming environment for your future peers and colleagues. Or maybe you're a nursing educator and you just want some thoughts or to share your own expertise with how you want to help prepare nurses to have that successful transition. So lots of answers coming in here. We'll just give you another 15 seconds to find which best describes you. Looks like about 17 have answered, and I think that's around, a few more coming in. So we'll give you another 5 seconds here. And I think I clicked the stop sharing button. And those are our results. Can you see those results? Great. So it looks like almost half here are students maybe wanting to or already working in med-surg. Some new grads joining us today as well. So perhaps you're just starting to navigate those new Cs. And very exciting to see some registered nurses and nurse educators making up over a quarter of our audience as well. So nice variance there. And we definitely welcome your stories or your questions throughout the presentation. So feel free to put those in the chat or save them for the Q&A at the end here. Okay, so before we jump in, we'll just do one more poll. Also curious what aspect of transitioning to med-surg is on your mind the most. And for those nurse educators and professional nurses that joined us, feel free to reflect back to your transition as a new grad or perhaps some of the questions that you're finding students are asking you the most. So I don't know if we can pop that poll up. So some B's and some C's. And the good news is if this is, giving you multiple answers, this really is what we're going to discuss today. So let's see. B and C seems to be quite popular.
Even if you feel happy to share just vocally, that would be great as well.
Oh, and all of the above.
Yay.
So that's good. We definitely are discussing the right things today.
Like I said, if you feel comfortable shouting out your answers voice with your mic off, that would be lovely as well.
Rebecca and Laura, it looks like this might be our best option with that final question as well.
Sounds great.
Okay. Well, we're really happy you're here with all of those answers. Thank you. So some tips for effective shift work schedules. I know this seems a little bit obvious, but over the years, this has kind of become the 4 major themes that I found new nurses specifically kind of struggling with. So nutrition, I worked shift work for a decade, straight 12-hour nights. I love the nights. But I always had to make sure I was prepared. So that meal prep, the day before, I always called it my midnight meal prep to prepare for my night shift. And that would mean that I would stay up, listen to podcasts, just be in, my jammies and prepare some really healthy meals. And I know that sounds super obvious, but a lot of protein, and there's a ton of research out there, and I won't bore you with the statistics on that, but really try and reduce those chips and all those really heavy snacks, especially when you're moving into a night shift. You want those really healthy meals, and gosh, avoid those vending machines. Guilty as charged. Your exercise, and this doesn't necessarily need to be your gym workout. I'm a gym junkie, but maybe you're doing yoga, maybe you're doing Pilates, maybe you're going for a walk, but just really remember that your physical and enabled body is going to enhance your ability to perform on shift. This also improves your mechanics and to prevent any back injuries, because oh my goodness, nurses at the bedside are at risk for those, and poor body mechanics and poor mobility. We think of our little grannies who are 92 and they're spry. That's what we really want to mimic. So just that consistency, and you're energized after you work out as well. Sleep. This is a tricky one, and I know everyone's going to have their own vibe and how you kind of work with that. And kids are tricky. I'm sorry to those who have children, but a consistent sleep schedule is going to make you feel regulated. So if that's creating an environment where your blinds are shut, you wearing an eye mask, the white noise, there's lots of free white noise apps available to you that you can play while you're sleeping, just to reduce that extra noise if you're working a night shift, that lawnmower in the middle of summer. Shift work isn't well known to everybody. We think because we work it that our spouse or our partners, friends, family are going to understand what shift work is like. So that communication and transparency is really the benefit to you. For me, my parents do not work shift work. So when they would call me at 1 p.m. in the afternoon, I would be sleeping. They would be worried and then come to my house and knock on my door. So just that communication piece. Hey, I'm coming off nights. I'm going to sleep till this time. Please try and avoid calling me. We just really need to make sure that they understand that piece, so we can be successful on shift. Okay, so now to the nitty gritty. Over the years, our higher acuity levels have elevated quite a bit. Again, I won't bore you with statistics, but they are quite high. We're now doing and seeing ratios increase. The units that I was currently educating on, we would have a 1:11 ratio, a 1:6 ratio. And this can be a little bit frightening as a new grad, and you're taking on a lot of responsibility that maybe you wouldn't necessarily had 10 years ago, or when first graduated, or Laura first graduated. It's no longer 1:2. So how do we help with that? Well, we created a 3 flags methodology. And so how do we categorize these patients so we're not feeling like we have to jump in all at once, but kind of check our pulse first before we head to our first patient. So it really is this quite simple, but sometimes to categorize it is the best way. So the first one is your red flag. This is your unstable patients. These are patients where vital signs are out of appropriate ranges or off the baseline of what that patient normally has. So for example, the patient's heart rate normally sits in the 60s. Maybe they're here for AFib, and all of a sudden night report comes on and they say the heart rate is in the 130s. Well, that is an unstable environment. As we know, AFib is a dangerous heart rhythm. So that would be a red flag. And the sheets that you would carry around, I would mark that red flag on that patient's brain sheet that you're working off of. Your yellow flags, these are the patients that you would see maybe second. So those red flags, of course, you're going to see first. It's like the red flag in the dating, you're going to run. Unfortunately, you're going to run to this one. But your yellow flags are yeah, this patient is here for an infection. Maybe they have cellulitis to their legs. They are at risk for maybe a sepsis, but at the same time, they are stable. So their vital signs are within their range or within their baseline. There's no abnormal systems assessment. So we could see them second. And then our green flag, again, marking these flags on our sheets that match the patients, would be our stable patients, such as they are awaiting placement, or they're discharged tomorrow, or they're discharged today, and we would see them last. So we can reduce that stress level. One of the best advices that I ever received from another nurse was check your pulse first before you head into that patient's room. And that really does just calm your nerves a little bit, because it can be overwhelming when you're new to this environment. So the 3 flag method, we do have posts on our Instagram for further information. If you'd like a copy of it, we can give you that in detail later on. Remembering that you are the professional now. So this is adhering to the standards under your licensing body, that continuous learning. So it doesn't stop in nursing school. And I'm sure you've heard that perspective and you've heard that comment so many times, but what does that mean and how do I continue doing that? Well, this might mean that if you don't understand something that happened on shift, then maybe on break, you're looking it up. Or maybe you're meeting with your educator and saying, hey, I have a question about XYZ. Can I set up a time to meet with you? Seeking support. This can be a little bit nerve-wracking too, because you don't know these people maybe on shift, or maybe you know a couple, but seek out a mentor. Ask someone on shift, hey, I'm wondering if you'd be okay if I came to you if I had a couple questions on and off shift. Hopefully they're open to that dialogue, but it gives you that open door policy that you can ask a question anytime and you're not afraid. They're not going to seek it out to you, so you have to go to them. Most of the time, our senior nurses are kind of tapped out, for lack of better term. So it is important to be open in your communication skills with that. Another little tie-in with being professional is you might be walking into a patient's room in one of their worst days of their life, whether it's the family having the worst day, the patient's the worst day. And you need to be and present yourself as professional. I speak a little bit about dress code when I do my orientation guides, but your dress code is set by your institution policy. And of course, you're entitled to wear whatever you choose. But crew necks and t-shirts, it does appear and can maybe not instill a lot of confidence in the patients and families that you're dealing with. That means showing up to work. You don't need to spend $200 on a pair of fake scrubs, but just be very mindful, proper body odor. Is your hair neatly tied back? It's not up to the side and it looks like you rolled out of bed. You are representing a protected title and you are adhering to those standards. And that means to look and act professional. Be mindful of what you're saying at the desk. Be mindful how you're speaking. Keep the swearing maybe to home time, but be very cautious on that presentation, because they are instilling their patients and their loved ones in you. So that report really does start with the first 10 seconds that they meet you.
All right, so getting a little more into some of the nitty-gritty about how we've developed ourselves and helped students kind of manage those day in, day out routines of the shift. One strategy that's been really effective for us is the OPA, and I always want to say it like a Greek, and I wish I had a plate I could smash on the floor or something while I say it. Organize, prioritize, and assess. So again, going back to what Rebecca said, you're going to have multiple patients and you're going to have competing priorities. And I think one of the hardest transitions of a graduate moving into their sort of self-regulation, autonomous professional practice is that prioritization piece. So again, as you're transitioning, this really might mean coming a little bit early, reviewing the charts, starting to kind of sort those patients based on acuity, and then deciding what your priority assessments are. So we kind of look at that as OPA. First, get yourself organized. We've developed some brain sheets that we find work really effective for our mind, but it's as simple for you as, going on Microsoft Word, creating a little chart, tailoring it to what the unit needs. Is this somewhere where you're checking a lot of blood sugars? Are you doing, a lot of dressing changes because you're on surgery? And have a template that kind of matches how your brain flows. With that prioritization piece, that's going to look a little differently depending where you practice. So for me, I started on a med surg floor where we'd have up to, I think, 8 patients on nights. So really for me, it was prioritizing, do I need to see, room A or room C first? But if you're going somewhere that's more acute and perhaps you only have 1 or 2 patients, that prioritization might take place within the human body. So, am I concerned about this patient's neurological status first and foremost, or is this a breathing issue that they've been admitted to? So that prioritization, even if you only have 1 to 2 clients, you're still prioritizing how you need to organize that care. Perhaps there's someone who is in for a post-operative surgery, but they're also a complex diabetic. So you need to consider, how those body systems are interacting with each other. I will say when I first transitioned to med surg, I was not an efficient nurse. And I was that one that was running up and down the hallway because I forgot my alcohol swab and then I forgot my saline flush. And I probably was doing 3 times as many steps as the other nurses. And I couldn't really figure out why I was pretty much crawling out off the elevator when I was done, because I was just so exhausted. And I was like, I'm young, I'm healthy, I've got this, but I'm just so tired. And I really think it came back to that lack of efficiency. And until I started to organize my day around that concept of clustering care and sort of going into the room and doing multiple interventions, assessments, and pieces all at once, I really struggled to find my groove, because I'd want to do all the vitals and then I'd want to come back and wash everybody up and then do meds and then do, some of those interventions. And once I could organize my day to sort of go in and get multiple things done, I did find I ran much more efficiently. And learning the routines of the unit really helped me as well, because if I got to know, okay, tests kind of start around 9:30 and lab comes in for blood work right as we're getting reports. So let them do their thing. And then once they're out, you're not going to be stepping on each other's toes. I found that really helped me to settle in. One piece of advice that I would give is you're maybe doing that orientation. You do need to sort of get in there. You're no longer a student. You can't do your entire orientation in an observational role. I really don't know beyond graduation and even during learning as a student that observation really gleans you as much experience as we like to think it does. I know there's the see one, do one technique. And of course, I'm not saying go in and do something you've never done before, but at this point, you've done a head to toe, you've done vital signs. There's not really a need to watch somebody do that the first time. Assuming that you've applied to a unit that you're professionally appropriate for based on your own self-assessment, you have those skills and competencies. Those are entry level. We're beyond that. So you need to just jump in and try to keep that observation to a minimum.
I'm going to speak to the clinical instructors or the med surg instructors that are in this content or in this presentation right now about that merely observing role. So of course your institution absolutely will set, there's certain boundaries that you can and cannot move past. But when it comes to students, a group of students on the floor, having them observe the primary nurse do their routine, again, isn't beneficial. The students have been taught to do a head to toe assessment, depending where you are in the curriculum. So they really shouldn't be watching the primary nurse. And the reason why I say that is because as a primary nurse, depending how long they've been working, that primary nurse may be able to skip a couple steps because they've assessed this patient 3 days in a row, or they are very well equipped in the head to toe assessments that maybe they can do things combo like your lung and your heart sounds. But the students watching that, they're not going to complete that head to toe based on what they've learned, and they're going to miss the crucial steps. They're going to miss that they've didn't hear crackles, which is critical to the patient's day and how we're going to intervene. So I would really try and avoid that viewing and that merely observing as well. If you are having a group of students, get them in there, get their feet dirty. Yes, they're going to be scared. That is okay. But this is how we get them confident and get into year 4 where they are feeling capable of taking a full patient load in their preceptorship. And then once they graduate, they're not again still in that observatory role. Any advanced skills when it comes to CVADs or PIC, of course, absolutely use the instructor, the primary nurse is there. But if they can put their sterile gloves on and practice that piece and maybe hold up part of the PIC if they're cleaning it, absolutely get them in there. Again, watching the see one, do one, teach one method, it is a bit outdated when it comes to the basic skills that they've learned in their curriculum. Okay, so commitment and to be to present. So be engaged. We lately with the staffing ratios, it is a little bit tricky and there is a bit more of a apathetic theme going on. But we can engage each other unless we can basically get into any sort of education or a little in-service, or even just ask a senior nurse, ask your charge nurse, ask physio, ask pharmacy about what is going on with your patient. I feel like pharmacy, yes, they can be a hair annoying, but they are so well educated in pharmacology where we kind of miss that in nursing. That use them, ask them about the medications that you're giving. Why not? What are you losing? Long-term commitment really does instill confidence in the company that you're working for. So for example, I worked medicine for a decade before I moved into emergency medicine. My manager had recognized that, wow, this person is long-term. They're not, maybe I had extracurricular jobs, but I always maintained some stability. And it was a permanent line and I was still able to maneuver my shifts, but able to foster those relationships. It also grounded me because I felt confident every day that I went into work, and that confidence built. And then once I felt like, you know what, I'm ready to move on. Again, my new manager in my critical care department knew that I was going to be reliable because of my tenure. Full-time really is beneficial to you young nurses. Yes, it can be a bit exhausting, and I recognize that children and, you know, extracurricular life can be affected, but if you can try and stay to full-time as close as possible, you will have that structure. You will have the confidence. You will not go in like a first day, everyday perspective. You're going to know where things are. You're going to understand the routine. You know, if you're not really well versed in the night shifts, maybe you can trade them. But if you're there, you're going to gain the skills and you're going to gain that confidence. Floating positions and floating roles, even if it's within the department, should be reduced to a minimum. And it actually really shouldn't be anyone who's been out less than 2 years. And the reason for that is learning to anticipate the needs of the physicians, the nurse practitioners, your pharmacy, your physio, tests, etc. And then of course the patients. If you have never been exposed to any of this information before, how are you going to anticipate the needs if you don't know? So those floating roles really should be someone who's about 2 years in and or greater. You understand the routine of the hospital, you understand and have built relationships with maybe other managers, bed utilization, other people within the institution. So be mindful of that. Sometimes those float positions aren't really well received because it can be a little bit daunting and everyone wants a home base. So don't feel pressure to go into that role unless you feel established in where you're already working.
All right, so this is just a fun little acronym that we came up with to kind of have success on your clinical day or your shift. So we like to joke that we're the only people that are allowed to call our students pricks, because basically what this stands for is to be successful. We really do believe in that being proactive approach. Again, as a student, but then even in that transition as a new nurse, you do need to sort of show that degree of initiative and being self-directed. Nursing is self-regulated, and that term really is important. Maybe you feel like it's glossed over a bit in school, but what that means is that there's no one looking over your shoulder anymore to kind of do that check-in with you or ask, you know, how you're doing or what are your learning needs. Hopefully you'll have some of those pieces in place to foster a good orientation, but ultimately, I think a common thread of this presentation today is that you're in the driver's seat, and really the amount of success you see is going to be correlated with the amount of initiative that you show and how much you're able to kind of speak up and advocate for yourself and your own learning needs. And definitely, I will say, you know, for better or for worse, those are the students that are remembered. They're the ones that get, you know, approached first when there are those special learning opportunities or new things going on, because that rapport and trust has been built with the staff that, again, they know, you know, you're reliable and you're someone that's going to show up, or someone that's really dedicated to the position, not just here because it was a way into your health region or it's a stepping stone onto something else. Again, that rationale is so important. We are big advocates, you know, of that evidence-based practice approach, which again goes back to that clinical instructor still being in that role to really lead and teach, and, you know, seeking out evidence-based practice, recognizing that things are evolving and changing quite quickly, and even things that perhaps you were taught in year one of your education might not be the best way that we do something anymore. I think that appreciative inquiry, or that inquisitive philosophy, again, asking and wondering why something's being done. I know for me, that's something that's really important. I struggle to see, you know, a test on a chart or a result or a medication and not really be able to trace back as to why something like that would be happening. Of course, nursing is a team sport. It's not realistic to say, you know, that you just prefer to work on your own. That's not how it's going to work in med-surg. You have to be able to function in a team, both within your nursing team and interdisciplinary. So you have to be able to be collaborative and be able to, you know, when to step back, but when also to take the lead. And then, of course, being kind is number one.
And it doesn't go as far to say thank you to the people that you're working with, your educator, or even to yourself. Thanks. I had a really good day myself, you know. I just want to add in, when it comes to inquisitive, that little piece there, we always want to make sure that we're maybe instead of just saying, well, why this, why that, but look it up first. What is an echocardiogram? Okay, I looked this up, but now I have a follow-up question. You're going to get a lot more of a response than just saying, well, what is this? Okay. So look it up first. Start that initiative. If you start that initiative now, it's going to carry on as you go forward, and that self-directed piece will follow you throughout your career.
All right. So as you know, med-surg really is all about critical thinking and collecting the dots. I've never been a big concept map person because I think they just get a little too vague, or they just kind of seem like they're more linear. So what we came up with was this disease process map. And what it's designed to do is kind of map through connecting what's happening in the body, your lab values, your assessments. What do I need to do? How will I know this person's getting better? How might I know they're decompensating? And really, the reason we just wanted to show this to you is to hone in that philosophy again of lifelong learning. I think sometimes maybe there's a thought that the second you graduate and move into an employed position, that all of your continuing education is going to be really mapped out for you. Every single second that you spend studying is going to be compensated. It's going to be on work time. And realistically, I don't know, especially in those first few years, that that's a fair approach to take. I would argue that if you're applying to, say, a focused renal unit, then there is that basic understanding from your employer that you will take that initiative to get up to snuff on understanding what the diseases and pathophysiologies and treatments are on that unit. So you do kind of have to self-assess where you're at in terms of the level of acuity that you're willing to take on in those first few years, and be honest with yourself about what your learning needs are, and that there are some times that you're going to have to look stuff up on break. You might have to go home and study a bit to get to where you need to be. And of course, if there's, you know, a mandatory certification or something like that, yes, your employer needs to facilitate that. But the reality is that that learning on your own time really shouldn't or doesn't stop. So again, find a way that works for you. I like our map because it's a one page. I can write the disease at the top. and I can kind of work through in a more structured way rather than just concept mapping out, which to me, the concept maps I've seen tend to just be a piece of paper turned sideways, and it's really not connecting the dots. It's just a bubble with a bunch of assessment findings, another bubble with medications, but it's not really telling me, you know, why is that medication causing that assessment finding, or how is that medication going to change that assessment finding? So again, just be prepared if you're going into med surg that you will have to do additional work on your own time to really learn some of the niche diagnosis of that unit.
Okay, so we adapted this actually from our clinical instructor guide, but we're going to give it to you as a toolbox. So everything so far in this presentation is something for your toolbox. We do have the disease process map available for purchase if you would like that on our Etsy shop. So transparency, that's our T. That's just being very clear about the nurses that you are working with, your manager and your educator as well. This can indicate, you know, hey, I've never done a fully catheter insertion before. This is a skill that I'm maybe not super confident with, or I've never yet had a patient, they've all been super healthy, and I've never auscultated what a crackle or a wheeze sounds like. If we don't know that information, we can't help you on the floor, okay? So just be clear, and there's nothing wrong with not knowing something. I work in critical care, and there are lots of things that I have never experienced yet. And I'm very open in that dialogue after working almost coming up on my 15th year as a nurse. So it is okay to say that. If at 15 years of working, I can say that, I know you as a new grad can say that as well. Express about what you can and can't are confident in. So again, for me, there's certain things in critical care that I just do not feel confident yet. And I need to be able to communicate that to my team. If my team doesn't know that, they're going to assume something that I can do it. And then if I go and do it because of this assumption and I hurt that patient or the quality of life is affected, that really is on me, okay? Don't downplay yourself. The requirements that you went to school for in your in the licensing body that you fall under, there are new grad a list of like qualifications and things that you should be meeting before you go into a unit. Okay. Those of you who are in bigger centers, each institution that you maybe work with may have different values and goals. So do a bit of research before you go and apply. Maybe you loved the med-surg unit that you were working on, but maybe there were a couple of things that really didn't quite work. They didn't have an educator, or they don't really have consistent staffing. Maybe it's more of a casual base. So maybe that place to support you when you're first coming out isn't the best, even though you liked bits of it. Maybe you can revisit that at a later date. Go where you feel that you are going to fit, okay? The beauty of nursing is we can rotate, but again, just remember that secure and that kind of consistency is gonna benefit you the most. We talk a lot about open dialogue, and that communication and transparency is huge. I feel like in the computer-centric world that we live in, especially when we are using patient charts electronically, those of you who are there, is we almost forget. We forget that we have mouths and we have tongues and we can communicate information. So be open, share how you feel. Hey, this went really great today. Oh, okay, I feel like I liked this, but I'm not super confident with this. Have some humility. So I feel like too, as nurses, we want to be, I am very good at this, and I don't want to say to anyone that I'm bad at this or that type of stuff. But regardless of the style that you have, whether it's more of a visual perspective or you'd rather just read, we need to be open to that perspective. As an educator, it's tricky to kind of identify everyone. I can speak to that. So you have to do your best to kind of collaboratively meet everyone's needs. But if something isn't working for you, you have to be able to approach that with openness. And then receive that as well too. So don't be offended if someone says, hey, maybe we need to try something a little bit differently. I'm going to move into a little bit more of the feedback approach in a bit here, okay?
All right, so I won't belabor this slide too much, but really it's just that highlight that especially when you graduate and move into your own role of working, that the balancing act, for me, it definitely changed a little bit. I was someone that lived at home during school, so I was very privileged in that way. And I did experience quite a bit of shock when I was transitioning to a new career, but then also making life transitions and starting to support myself financially and really having that identity change. It was quite fascinating. I didn't realize how much the identity of a student mattered to me until I didn't have it anymore. And it was a very big change for me that I couldn't no longer call myself a student, couldn't enjoy the student discounts, didn't really just kind of get that free pass that I didn't realize I was getting when I was a student. So that was a big change I wasn't expecting. And the financial transition as well, just realizing how much toilet paper costs, how much those different, how much taxes come off of your paycheck. It's a very big time in your life. And I would just say, if I could give any advice, it's try to scaffold or minimize the amount of changes that you're making all at once. So again, if you can maybe work closer to home and really the job is the only transition you're making, it maybe isn't the best time. And again, everyone does their own thing. I'm not going to micromanage your life for you, but is it the time to move across the country, get a new job, buy a house, have a puppy, and plan a wedding? Maybe that's how you thrive and that's, great for you. For me, that isn't maybe something I needed to take on all at once versus maybe incremental in 3 or 5 or 6 month blocks. So again, your routine is going to change, your location might change. That identity change, I would just say be prepared for it. And maybe it was just me, but it was a big change to not go back to school again and kind of have that flexibility. And then the financial transition. Unit expectations look different when you're a new employee versus a student. You're going to have those different relationships again with colleagues, and that education orientation can be quite intense. I actually recently just switched my casual employment with the health region, and that orientation was a lot more than I was anticipating. It's been a few hundred hours that I've had to, flex into my life, and it's definitely been conversations I've had to have with my family about what that's going to look like temporarily. So as you're making these transitions, we kind of love the golf analogy, just to be, thinking about how you're evaluating yourself and how you're doing this. So those of you that obviously know how the sport of golf works, every hole adds up to your total score. It's not like hockey where it's a 2-to-1 goal, and really all that matters is perhaps in the last few minutes. I just really want to emphasize that consistency matters, and you have to kind of be ready to go and on every shift. Nursing really isn't one of those professions, where you can mentally log off after your lunch break. You do need to have a plan, and you need to sort of go in with that full day commitment, especially, regardless of like the level of nursing that you're doing, there is those different skills. It's not just, being able to start the IV, but it's understanding the why that IV is going in. It's getting to know your patient. What is their plan for discharge? Interpersonal communication skills, knowledge, behaviors, different attitudes. I always say, just like golf, you can't necessarily recover your shift or even your orientation on that last day. So if you've been kind of, again, passively observing for your whole orientation or disengaged, you can't necessarily get ready to go on that last shift. So I just kind of want to put a plug in for that really full-on commitment day one, and that consistency matters. And again, for me, I've noticed with students, it really is that prioritization piece. And then just, being able to critically think, which hopefully your program has prepared you for. But just what does that critical thinking piece look like? And it's the nursing process, right? It's being able to take in information from all different angles, the lab values, the objective, the subjective, the medications, the different multidisciplinary reports, and be able to use that to form a clinical judgment or a decision. So just one more poll here and we'll let you answer it in the chat. We want to know, as Rebecca mentioned, we're going to talk a little bit about that feedback piece. So what best describes the way you prefer to receive feedback? Do you like to hear it as soon as it happens? Do you want a heads up and maybe have a plan to meet later? Do you kind of have a no news is good news philosophy? Or would you prefer that we just give you a compliment and leave it at that? So kind of a bit of a silly one there. So sometimes that in the moment piece. Thanks, Catherine. Some likes for that one. Lots of A, but some recognition that depending on the significance, usually A, but sometimes B. And I appreciate that one because A might not always be able to happen if, you know, it's something that we need to move on or there's other competing priorities, or if we need maybe some more time or just a bit of opportunity to process what happened, B can be great as well. So no one's admitting D. I like D. I like to get complimented, but certainly that's not the way it works, especially when we're trying to develop ourselves professionally.
Okay, so feedback is a little more complex than just asking about how did I do. It's too broad. We need to be specific on asking the question. So, for example, I just put in a Foley catheter. How do you feel like I did when it came to the insertion part? Maybe you felt really confident up until then, and then you struggled a little bit. The person that you're orientating with, preceptoring with, or even your instructor, they're going to notice those things. And so, but saying, oh, you did fine, and maybe you did do just fine. Don't look for it, don't seek for it unless hopefully that person is they're honest with you that it is doing good. But be specific in what you're asking. Maybe after you just came out of a patient who's been deteriorating and they're not doing very well, and that situation was new for you, maybe 20 minutes after that isn't the best time to ask for that feedback. So you need to prioritize on maybe a better day. And maybe it's 24 hours later, and that's okay. Maybe it's 12 hours later. Maybe it's, hey, can I send you a text message and can we re-collaborate on the events that happened today? Those types of things. Body language is key. We talk about this, I think, in first year nursing about how you present yourself. So if I'm standing there and I'm already feeling anxious that I'm going to get just berated, or I'm feeling very defensive, that person giving you feedback is going to read off of that as well. And then vice versa too. You know, maybe that person isn't really the best person to give you the feedback. Maybe it is a nurse who unfortunately has the mantra of, I like to eat, they're young and they're in a really bad mood. Side note, not appropriate. But maybe that person is, we're not asking them right away. So it really does depend. I think you need to really assess that information. This isn't in there, but not everything is about you in that situation. Be mindful of that. So this is always about the patient in nursing. It is back to the Florence Nightingale era. We are putting the patients before ourselves. Okay, it is a very selfless profession. So maybe there's too many things that other people need to triage before they get to you. Consider the source, and I kind of touched on that. Maybe it isn't someone who's the best at giving feedback. Maybe they are just kind of known as a not so great nurse to be around on shift. So, and they're kind of mean to everybody. So if they say something, maybe you could take it with a grain of salt. Maybe they have a piece of advice, and you can compartmentalize that piece and say, okay, I can take that, but I'm not going to take anything else around it, and I'm going to internalize it. That really is a key piece of feedback as well. You want to improve, which is why you're asking, but don't internalize the negative or the tone that it's you. Unfortunately, it might just be them. And we know that from a societal perspective that not everybody is going to align with your values and beliefs. So, and that's the same thing in the nursing world. Follow up, ask. Come back. Maybe that was just a bad day, and the nurse maybe themselves needs to go home and decompress. So follow up in 24 hours, follow up in 12 hours, and just keep it really open-ended. Hey, that day was extremely chaotic. These are the things I felt that I did really good on. These are the things that I think I could improve on. Do you have anything else to add? Again, going back to being specific, okay? You have to self-regulate, as we talked about, and that self-reflection is extremely important as well. we're not perfect. We're never going to be superstars in every situation. So we have to recognize our strengths and maybe some things we can improve on. Asking the question is super important as well. So again, too general isn't going to get you anywhere. No one can read your mind. We're not dating. No one is going through the dating method. We're like, does he like me? Does she like me? I don't know. So be specific. I talked about the Foley catheter previously. So maybe, yeah, you felt like you struggled at the insertion part. What did I struggle with? What did you see that I could have done differently? Do you feel like I'm managing my time appropriately? These are the things that I feel like are important. This is why I did this. What do you feel? It is okay to acknowledge that maybe you didn't do something correctly. Again, I always refer to when I'm in critical care, because that is a bit of a steep learning curve for me. So I have to be open about that dialogue. Even as an educator, I do like to talk to my colleagues and say, hey, I'm new to this. This is new for me. I feel like I am on the right track here, but I don't feel really good about this. What do you think? Or how could I improve on this? So those really general questions, the person providing you feedback are just going to go, yeah, you did fine. Especially someone who isn't great at giving feedback, they need something to go off of. Unfortunately, we wish everyone was a wonderful feedback machine, but that's not always the case, especially with whomever you're orientating with.
All right. So on that note, you probably all heard about the sandwich feedback method. It's not something that I found really effective, and it's not something we've used in our teaching practice because it lacked kind of that piece of self-reflection where, again, you're the first person that needs to ask, okay, so how did that go? How did I do? And it doesn't really talk about what's going to change next time. So we like to joke that instead of sandwiches, we like to feed our students or our new colleagues that we're mentoring wraps instead of sandwiches. So instead of that framework, what we find really effective with giving or receiving feedback is the wonder, reinforce, adjust, plan framework. Because again, then you can say to yourself, okay, how did that go? What did I do good? Because it's very rare that any event in nursing is a total wreck. There's always good things that happen, and typically more so than maybe the one or two adjustments or tweaks that need to be made. And then the part that I think is really important is that plan. So, okay, this scenario is inevitably going to come up again. What do I need to do differently so that this doesn't happen, or so that I can improve? Or maybe it's so that this goes exactly the way it went before. What did I do really well that I need to keep doing? So just some food for thought, no pun intended, when you're giving and when you're receiving that feedback, because you'll give feedback too. We encourage you to do wraps instead of sandwiches. So we're just wrapping up here. And the one thing we do want to kind of allude to or talk about briefly is, again, that way you represent yourself. And this has been a thread throughout the presentation. We talked about it in person, but because we do so much electronic communication, we just want to briefly touch on some of those pieces that we've done. Again, we've been students, we've been instructors, clinical educators, and in both sides of those roles. So again, take what off this slide is useful for you, but we do find it really effective to be mindful that you are, again, still in a professional role. Avoid kind of that colloquial language of just saying, hey, or no greeting in your email at all. I know for me, I start every email with good afternoon, good morning, or good evening. It's never steered me wrong. It just kind of sets that tone that this is a professional email and that it's going to be well organized and well thought out. Again, use your own judgment, but is it the time for excessive emojis and exclamation marks, or is it a professional request with another professional? I think it's really important, again, when emailing your manager, your educator, a colleague, if you have a concern or problem, make sure that you're addressing it objectively and come up with a suggested solution. So again, if it's just venting, really be honest with yourself about what the outcome you want of that email is. It's the same thing for an SBAR, right? You wouldn't do an SBAR without that recommendation. It should be the same in this case for sure. If you're looking for further training or education, again, if that's wanting to be a paid opportunity or something you need them to pay for, really selling yourself as to why that can help help benefit the unit or benefit yourself. Hopefully it's common sense, but nothing in your email, especially Your institution's email is actually private, IT has access to it, and there's a paper trail for life of that. So again, don't say anything that you wouldn't be comfortable saying in person. Your name is still very much attached to that. And that is a work email. It shouldn't be used for, your online shopping or your personal communication. If you are expecting to hear back from someone or wanting a response, I think it is important to be clear about that. We were talking as we were getting ready. A lot of units can have 300 or 400 staff, not exaggerating, especially if they have a large casual pool, or maybe they're a hybrid, medical, surgical, postpartum obstetrical unit. They can have a lot of staff, and your manager might not have that personal relationship with you yet, or they might be fielding hundreds of emails per day. So I think just ending your email mindfully if you are expecting a response is important, because they might not know that otherwise. And then that could potentially weaken the relationship if you thought the email was ignored, but in their version, they just read it and moved on because they didn't know, they thought they were just getting an update from you. They didn't realize there was an item for action there. And then with that piece, just being mindful that, again, we're all professionals doing our best. You're not necessarily entitled to a reply in a certain amount of time. Being mindful that other people might have competing priorities. So setting a time frame, or really saying, something that could be interpreted as maybe a little bit abrasive in terms of wanting a response, might not work in your favor. And my little icon there is just that reminder that you can catch more flies with honey than with vinegar, and just kind of keeping that positive regard for other people initially, because we are just kind of all coming in with that appreciation.
I'm just going to add in a touch too, because there are pieces where maybe management or maybe certain educators like to overuse text messages or maybe inappropriate messaging. So be very clear, like if I were to text, someone in my educator role, it would be just to confirm that they are coming for a certification, or I would ask them to text me immediately if they cannot make the certification, or a sim that I'm doing. And that piece is just so I can get it right away. But if I do not text them outside of hours, then you shouldn't be receiving that. And this is to protect yourself a little bit as well. So be that kind of 8 to 5, 8 to 4, whatever you set your time at, and especially as a shift worker, I would maybe stay out of that. I mean, absolutely send an email, but if you want a professional follow-up, as Laura mentioned, in your institution, IT can track it. So if you're looking to have support, or there is an emergency and you need that follow-up, use your email, because your text messaging system will not, if you needed to take it further up in the line, it doesn't follow you as well. So use your email thread. It is the best way to support you if you're in a situation that maybe you feel compromised in.
All right, so that kind of concludes our formal presentation piece, and we're excited to listen to some of your questions or thoughts or suggestions. And just that, I think, take-home message that we have for you is that really this is a verb, not a noun. Orientation in this transition is not a passive experience. We really want you to be successful in that driver's seat, and certainly we don't ever want new graduates or students to feel like it's sink or swim. So we want to say just, find your groove and improve, but have that be really an active experience for you.
Thank you so much, Rebecca and Laura. That was just outstanding. I'm thinking about when I was a student and a new graduate, and how important it would have been to hear all of these pieces and to be a little bit grounded in expectations. So I'm so grateful to you for that presentation. Are there any questions? Please feel free to put your hand up or throw the question in the chat. I know sometimes questions come up later. I'm just looking at them. Yeah, that's Kate. I just wanted to make a couple of points, Rebecca and Laura, that struck me about what you were saying. I love the light system. The light system works perfectly. I used it with my students all the time, and then you could see them using it as grads after that. And I even encouraged them when they would get report, to have markers with them, and they could circle particular things with red and particular things with yellow. Green, obviously, you don't need to circle anything, but but I loved your light system, so thanks so much for that. Kate,
Play.
interest me if there are any questions that that you want to throw in here. You know, your comments about presentation and professionalism really touched a chord with me. You know, I don't think we always realize the experience of a threat to one's health or to the health of a family member, someone that we love. It's all about us in that moment. And so if something is heard in the hallway or nurses are talking in the nurses station, a lot of times patients may not realize you're not talking about them. They may very well personalize what they're hearing. So I think that your comment about, you know, keep your voice down and think about what it is you're saying with your colleagues in the nurses station. Go to the lounge if you want to use some dark humor or whatever you need to use, because we all need to use it, but just be a bit careful about context.
Absolutely. And I think it just depends. Like we all, as nurses too, we carry a lot on our shoulders, and especially as a new grad. Sometimes, like you said, that dark humor does just kind of neutralize it a little bit as well. So I agree, though, there's a time and a place for it, not outside a patient's room, where maybe they're going to internalize that or misinterpret it. I mean, we know that we deal with people who have compromised hearing, maybe family members are misinterpreting it, but we just have to be really conscientious about that. Please don't mention that you were out drinking the next night and now you showed up to work hungover. Please don't show up to work hungover. That is absolutely unprofessional. I'll be blunt. I had someone share that with me just yesterday at work, and I was appalled. I just don't even know what that concept is to me. So be mindful. Like that is, and I'm sorry, I'm going to get a little bit of a rant here. That is unacceptable. You cannot show up to work where you are hungover. If anything, I'd rather you call in sick, but do not come to work when you are dealing with patients' lives and you're compromising it that way. I know most of us know that, but I just learned yesterday that I didn't think that concept was real.
Yeah, thanks for that. Thanks for that. It's just such a good reminder for all of us. And we need those reminders, you know, not once, but sometimes it's worth thinking about this presentation and maybe revisiting it in a month or so.
Yeah.
You know what I mean? And take some of those tips to heart as you can. A couple of other things I wanted to mention: minimizing the change during a transition. I felt like you were speaking directly to me in terms of my theory, because I talk to students, particularly students, because the grads, they get it. They're like, wow, I shouldn't have made all those changes. But it's when you're a student before you become a graduate that you can say, okay, let's think about what it is I'm going to do for the first 6 months after I graduate. I'm going to get married. I'm going to move to a different place. I'm going to buy a house. And you can make different decisions as a student and give yourself a little bit of a break in that initial 6 months.
Be kind to yourself. Absolutely. I think that's really the piece here is I feel like as a student, and like Laura mentioned this, we want to take on all of this, but you deserve to put yourself and your career first and focus on that. So again, just go back to being kind to yourself. You deserve that. You deserve to be successful and to feel confident and not to feel stressed with overwhelming exterior factors.
About, I guess it was a year and a half ago too, we did do a little discussion post about the concept of lifestyle creep as well, and how those aspects can kind of sneak up on you as you are a new grad. And I know I liked the overtime when I first started, and there's some hard lessons you learn about that as well. And just what that, again, that lifestyle transition of, you know, having more, so getting more can do. And like I say, I'm not going to micromanage your decisions in your life for you person, but just like we prioritize in nursing, you're going to have to make some prioritization decisions around your nursing career as well, because, you know, at the end of the day, this is your career, but life happens outside the hospital, and you want to be healthy and fulfilled when you're leaving your shift, right? So
yeah, it's probably a strong and steady recommendation as opposed to sprint out of the gate and think that you're going to be able to sprint for the marathon. You're not, and it is a marathon. So start out in a way that you can manage and be easy on yourself. Yeah, excellent. Well, Rebecca and Laura, I know we've kind of come to the end of our time, and there aren't any questions. I think people are probably just processing everything that you've shared. Lots of compliments in the chat about how important this information was and how on point it was for both students and grads looking to get into med-surg. So I just want to say thanks very much for this. I'm excited that we have two winners, Katie Bell and Tammy Erdman, are going to get the two gifts. But by all means, please do visit the Instagram page for Rebecca and Laura, because I've looked at their resources, and I was a big sort of a card carrying person, if you will. I had all of those med-surg cards when I was working in critical care, and they were so helpful. So please get on their site and see what works for you. So I just wanted to say thanks so much for this tremendous commitment to the students and new grads in our audience.